Depression is more than just a passing blue mood, a bad day, or temporary sadness. The most common symptom is a low mood that can sometimes appear as irritability. Often the person with depression is not able to enjoy activities that he or she normally enjoys. There are several types of depression, including major depression. With major depression, there is a profound sadness or a sense of despair. The symptoms of major depression are defined as lasting at least 2 weeks, but usually, they go on much longer. Bipolar disorder, previously called manic depression or manic depressive illness. Bipolar disorder is a mental disorder characterized by wide mood swings from high, manic, to low. It is commonly divided into two subtypes, bipolar I and bipolar II, based on the dividing line between mania and high. Bipolar I disorder is the classic form where a person has had at least one manic episode. In bipolar II disorder, the person has never had a manic episode but has had at least one hypomanic episode and at least one period of significant depression. Most people who have manic episodes also experience periods of depression. In fact, there is some evidence that the depression phase is much more common than periods of mania in this illness. Bipolar depression can be much more distressing than mania and, because of the risk of suicide, is potentially more. Persistent depressive disorder, previously called dysthymia. Persistent depressive disorder is less severe than an episode of major depression but lasts longer. Many people with this disorder describe having been depressed for as long as they can remember, or feeling as though they go in and out of depression all the time. Postpartum depression. A major depressive episode may occur within the first 2 to 3 months after giving birth to a baby. In that case, it may be called major depressive disorder with peripartum onset. Most people refer to it as postpartum depression. Seasonal affective disorder. Depression that occurs mainly during the winter months is usually called a seasonal affective disorder, or it also may be called major depressive disorder with seasonal patterns. A variety of symptoms usually accompany the low mood of any type of depression, and the symptoms can vary significantly among different people. Many people with depression also have anxiety. They may worry more than average about their physical health. They may have excessive conflict in their relationships or function poorly at work. Sexual functioning may be a problem. People with depression are also at more risk for abusing alcohol or other substance. Depression probably involves changes in the areas of the brain that control mood. The nerve cells may be functioning poorly in certain regions of the brain. Altered communication between nerve cells or nerve circuits can make it harder for a person's brain to regulate his or her mood. Mood